a forward-looking social enterprise that works with young people and youth-led organizations to improve access to quality healthcare services and products. Also, we have different things that we do, different projects, and one of them is mental health. So we have a platform known as the Youth Voices Network, which is a platform that is designed to enlighten, to empower young people, and to evoke action among the Kenyan youth to act for their health and the health of their communities. So today's focus is on mental health. So our Mental Health Youth Champions Network is a network of youth leaders and youth-led organizations that work in their communities to address mental illnesses and mental health advocacy in general. So through our project, we engage different stakeholders. So we use a multi-sectoral approach in a bid to build capacity of youth leaders to enable them to amplify their voices and also foster collaboration for sustainable development in addressing mental health. So that is a little bit about ReCulture. Apart from mental health, we also deal with sexual health and reproductive health, sorry. And we also deal with non-communicable diseases and neglected tropical diseases. So to get straight to the agenda of the day, World Suicide Prevention Day is a day that is set aside and was commissioned by International Association of Suicide Prevention, usually marked on the 10th of September every year. So right now, the theme that has been commissioned by ISPA is creating hope through action. And from that, we are trying to raise awareness with regards to suicide prevention, and also to see the role that we play as individuals and as a community to address the burden that is suicide. Also, we are looking at a global and regional efforts that are being undertaken in order to curb suicide. Our objectives for the day, first and foremost, before I delve into the objectives of the day, our major theme, the overall theme is creating hope through action, but the sub-theme that we'll be delving on is encouraging meaningful youth engagement in suicide prevention. How do we engage youth in order to advocate towards mental health? So the objectives of the day would be to raise awareness on mental health with respect to suicide prevention among the youth, and to also combat the stigma that is associated with suicide. Our second objective is to encourage multi-stakeholder engagement in mental health awareness and promotion. And our third objective is to share best practices in prevention of suicide. We have a group of panelists who are well-versed in mental health advocacy, who will be able to share their best practices drawn from experiences and exposure to the environments they have been. Also, our participants, you can feel free to key in your questions and give us your insights and opinions during the discussion that we'll be having. So just to give a brief background also on suicide, especially amongst the youth, it is the fourth leading cause of mortality amongst the youth aged 15 to 29, according to the WHO. And also we realize that suicide is very complex and it can be pretty much devastating, especially to those who have been affected by losing a loved one through suicide. But we believe that it can be prevented when effective strategies are put in place. So I'd like us to engage and also draw various perspectives. That's why now I think I'd like to invite our panel of discussants. So in our panelists, we have Dr. Odhiambo David, who is a mental health advocate, especially amongst young pharmacists. We are also joined by Brian Otieno, who's the team lead at Alpha Jiri and has a background in medical psychology. Our third panelist is Maureen Gikonyo, who is also the lead at Cities Rise, which is involved in mental health advocacy amongst the youth. So karibuni sana. I'd like to welcome you to briefly introduce yourself. So I'll start with you, Dr. Odhiambo. Karibu.
Thank you so much, Marion. Thank you everyone for being here with us. I acknowledge the work that you do, as well as just as you mentioned in Marion. And just to introduce myself, I'm Odhiambo David, a pharmacist by profession, and I'm passionate about mental health, having worked in this space from 2017. I believe as individuals and as members of the society, there's a lot of work we need to do, but unless we commit to it, then it's never going to happen. So for this particular discussion, for me, I'm excited to engage with people and also to learn with others in terms of how we as young people generally, we can contribute to overcoming the burden of suicide, reducing the numbers, and most importantly, creating a mentally healthy and supportive ecosystem for us to thrive rather than survive in it. And I'd be glad to engage and learn from each other. Thank you, Marion.
Thank you so much, Dr. David. Brian Otieno.
Can you hear me? Okay.
Yes, we can hear you.
Yes.
Just as was mentioned earlier, my name is Brian. I'm glad to be part of this session, and I'm looking forward to learning from each and every one of us. Just like David and Marion pointed out, I think young people have a major role to play in mental health, and it's with such sessions that we learn what has been done, what needs to be done, and what are some of the existing gaps that need to be filled for us to ensure that youth engagement is out there and widely felt in terms of the response to suicide prevention. So I'm looking forward to a very interactive session, and just to get to learn from also our participants on what is out there that we can also pick as people who are at the forefront of mental health discussions and response. Thank you so much. Over to you, Marion.
Thank you, Brian. Maureen, I'm sorry, I should have started with the ladies first. Maureen, you can go.
It's okay. Men before.
Okay.
Hi, everyone. My name is Maureen Gikonyo. I work with Cities Rise, Nairobi office. Cities Rise is an organization that focuses on best practices and policies. And we are currently in 5 cities, 4 countries. And I'd just like to echo what Brian has said on youth engagement and young people, because I've been working with young people and also being a young person myself, that young people have very innovative ideas. And when it comes to the burden that we have of mental health issues, I think young people are one of the groups that I honestly believe that have the most innovative ideas in the community and also globally. So I look forward to this productive discussion and interacting with everyone. Thank you so much.
Thank you so much, Maureen. I also look forward to a very interactive session and to be able to learn. I hope our participants as well. And also to reiterate my point, you can feel free to type in your insights as we go on with our discussion. So just to start us off, we are talking about suicide. So I'd like Brian Otieno, given your background in medical psychology, maybe if you could describe to us what is suicidal behavior and how is it brought about? Thank you. Over to you, Brian.
Thank you. Well, okay. We can define suicide in very many terms, but the most easily understood or commonly used is either there's an attempt and now the suicide act itself, which is causing harm to oneself or inflicting pain or harm to oneself and ending one's life by either using different means. So most of the time it's caused, and it's a disorder. The reason why I call it a disorder, it's caused by other underlying issues like depression. Most of the suicide cases we've had are caused or like an end line to depression. Yeah, it's like the end line symptoms to depression. So most of the time, depression is the leading cause of suicide globally, and depression has very many causes as well. But for suicide, in most cases, we have people either having the tendency or behaviors, and with time, which is now what we now call the act itself, is when people now try, because people have suicidal thoughts. So thoughts are just the tendency of thinking about or talking about it, and then now there's the act of trying to execute those thoughts. So we have the different stages, and basically with suicide, that's how we look at it in terms of the attempted, the actual, and the thoughts that people have that we call now suicidal tendencies or suicidal thoughts, yeah, or ideations. Over to you, Marion.
Okay, so Brian, you have given us a brief explanation of what suicidal behavior is. And I believe before we even get into devising implementation strategies or ways of combating the same, maybe Dr. Odhiambo and Maureen, you could share any other causes of suicide or suicidal thoughts, because as I had mentioned before, it's really affecting the young people. So are there any other causes of suicide or things that lead to suicidal thoughts apart from depression, like Brian had mentioned? So I'll start with you, Maureen, this time.
Oh my God, sorry, I just realized I was speaking to to myself. I had not admitted. So I think just like Brian has talked about, suicide is the act of taking one's life, or the attempt is, suicide attempt is the attempt to take one's own life. And apart from depression, there are also other things like drugs and substance abuse that can lead to the thoughts of suicide, and drugs and substance abuse can also lead to depression. So having those signs of depression from the drugs and substance abuse is quite something that we need to look at. And then also there's the mental illness. It does not necessarily have to be depression. It can be any other mental, I don't like calling them illnesses. It can be any other mental condition, like bipolar, like schizophrenia, or such things. So it could be not only depression but also other mental illnesses. Then there's also prolonged stress, or being in an environment that is very stressful. And I think for me, that's something that I personally struggle with. Wherever I'm in a place where I'm feeling like I'm very drained or I'm very stressful, most of the time I tend to actually get those thoughts because I have had depression before. And also there's childhood traumas and childhood abuse, or abuse in general. There's physical, sexual, and also emotional abuse. And also going through something like narcissistic abuse, it can lead to suicidal thoughts.
Thank you, Maureen, for sharing that. Dr. Odhiambo, do you have anything to add on that?
Actually, Maureen has captured the better part of it, actually, building on what Brian had shared. And I think when you look at the causes, there are causes, yes, which would be the underlying factors behind it. Somebody having a mental disorder, if you talk about it. We have the socio-economic factors that actually are currently serving as drivers. When you hear somebody saying that I wasn't able to actually fend for my family, what kind of a man was I at that particular moment? And these are other trigger factors that would come in. So when we look at the causes, we have the underlying factors, but beyond the underlying factors, we need to ask ourselves, what are the main triggers at the point when somebody makes a decision to actually make an attempt to end their life by suicide or to actually go through the process? So these are other factors that we look at it beyond it being an underlying causative agent or causative factor. Then we have the aspect where now there's a particular trigger, and these particular triggers would be revolving around, let's say, for example, we engaging within a particular activity or a particular forum, and then I become abusive to you. I actually become unfriendly to you. Then that would be a sign of me pushing you to the limit. Those are some of the experiences, and we've looked even when we see conversations that are happening on our social media platforms. These are drivers, but they would not be like, somebody would not say, by the way, whatever David did is what made this person take their lives by suicide, because they would not see that correlation at that particular moment. But it is a trigger because this person probably had other underlying stresses and distress calls. And instead of me being kind enough to be supportive, to get an environment where if they needed help, they would be able to reach out, they were not able to. Maybe I was not the person they could reach out to. And maybe when they needed to reach out to someone, I became a barrier to that. And therefore, the only option they hoped for was to find a way out of it, out of the suffering, out of the pain, and out of the distressful situation where they were. So that would also be looking at what are the other risk factors and the trigger points that you could be looking at when you talk about suicide. So that is the only aspect that I would add into that conversation, because the major bit of it had been captured by Maureen. Back to you, Mariam.
Okay, so I think we've tackled the major causes of suicide and or suicidal thoughts. So I think it would be best if we now delve into how can we combat or mitigate suicide or suicidal thoughts amongst young people, and how best can we as individuals help people who are going through suicidal thoughts be able to access help.
So maybe
yes, please.
Yes, maybe if I could come in first. When we're looking at supporting and actually overcoming the burden of suicide, one thing that we have to acknowledge for a start is that the burden of suicide is high and is on the rise. And to an extent, it would be associated with the contributing factor that we just talked about when talking about the burden of mental illnesses. There are so many stressors, and actually one of the key bits is we are talking about these stressors and they are kind of magnified in our interconnected and highly communicative world where everybody, we are expressing everything we feel, and we're also projecting it in different circles where it is. It's not that we should keep them silent and actually number our talks or our thoughts and ideas, but we need to talk about them and find solutions to them. And that is one of the reasons that I feel even for this kind of a forum, we are at a good place where we can talk about what really is happening in our society, what needs to be done to address them, and how it needs to happen. So we are in a society where the burden of mental illnesses are high. The rates of suicide are also on the rise, actually, in terms of the data that is being presented and that is being documented. But for us to overcome these, we need to address the underlying factors. If somebody has a mental health condition, which we find out that mental illnesses are contributing actually up to 25% of the risk of somebody attempting to die by suicide or taking their life by suicide, then we need to ask ourselves, do we have the healthcare facilities and services that are needed for people living with mental disorders? If we don't have the services, we don't have facilities that have qualified professionals, we don't have the medication for those who need to use medicines, we don't have techniques that actually can help us diagnose, because if you don't diagnose, there's no way we are going to treat these patients. We are not going to address the problem. We look at it from a socioeconomic standpoint. What are the different social determinants of health? Are people able to access these resources and these facilities that they need to live meaningful and effective lives? If they don't have them, then we need to ask ourselves, what are we going to do to ensure they're able to get what they need to be cushioned from having these distress calls? Because the distress calls are what is going to push them to the next phase of tipping over the scale. So if we don't address those underlying factors, we are not going to make a move. And then the other thing, beyond the underlying factors, we need to talk about it from the point, from me, I feel we need to look at it from the trigger point and from the social cohesive frameworks that we have. As individuals, we know human beings are social beings. And as social as we are, we need to ask ourselves, are we being sociable enough and being supportive in the humane communal existence that we have? Or do we take advantage of our communal sense, our social being, for our own preferential interests and advantages? Probably I would be relating with Brian Maureen in this call because we have a common interest, we have a common agenda. But beyond that, am I a human being who is humane enough to embrace them and reach out? By the way, Brian, how are you doing? Can we hang out and just at least get to talk with this person, personal level, to understand what are they going through? How do we become each other brother's keeper? And if you're not going to do that and we just superficially, we would engage, would laugh, would comment on Twitter, LinkedIn, Instagram, post the amazing pictures of whatever we're doing in our personal lives. And then at the end of the day, when we go back home, we are dealing with our own stresses by ourselves. And these are some of the things that would push us to that limit. So our humanity has to be embraced. And once we embrace our humanity, then we are able to overcome the hurdles and the challenges that we're dealing with. And that is one of the some of the recommendations that I would have. I would leave it to Maureen and Brian also to share in on some that they could have. Mariam, back to you.
Yeah, you have spoken about tapping into our humane nature, and you've mentioned some of the things that I think we'll discuss later on further in this discussion, majorly drawing on the challenges that are affecting mental health care access in Kenya, particularly for the youth. Now, Maureen and Brian can also give their insights on how the youth can be meaningfully engaged in the fight against suicide. So what is the role of youth in suicide prevention, and how can we help mitigate cases of suicide and or suicidal thoughts? Maureen.
Thanks, Marion. So I think when it comes to suicide prevention, it has to start from an individual basis, and it's also something that the community should do. I think also each country should look at, and I think also we need to look at this globally, because honestly speaking, this has now become a global issue and a threat to people's not only their health, but it has also become a threat to to our world. So the first thing I think we should do as an individual, is knowing when to seek help, and I think I always love to say that it's okay to seek help. And David has talked about, having stressors and having stresses, and I think I've also talked about it. So when do you think is the time to seek help? So for me, it's important that we learn how to seek help, or we learn how to pick coping mechanisms that work for us. And when I speak about coping mechanisms, I mean positive coping mechanisms. And then also at the community level, and I've loved that David has brought this up, looking at it as how do we create safe gathering spaces for communities? Like how do we create support systems for communities? And honestly, for me, something that I'm actually happy that no, I'm just gonna come clean. Like, I do not get why we have to invest in institutions, because the government and many people will have a contrary opinion from this, but I do not get why we need to invest in another institution in the country while we are still struggling with community-based services, programs, and care. So for me, that comes first. Like, how do we ensure that we have community-based services, programs, and care in the community that everybody can be able to, to seek services from, or services and programs and care can be accessible, available, they can be of quality, they can be acceptable by the community. So for me, that's very, very important. And then this is connecting to the national level. Like, what are the best areas that the national level is looking to invest in? Because I mean, we are making a lot of noise about, can we invest more money for mental health? Can we increase money? But what exactly are we looking? What exactly are we saying? Increase investment in what? So for me, it's like, can we start looking into investing into these community-based programs, services, and care that people can be able to access? Because one, for sure, something that we are missing in this country is, and not only in this country, probably globally, because I'm sure, David, Brian, you've interacted with so many people around the world, and it's a major problem. So how do we start looking into community-based program services, investing in that? And also looking into policies. Are the policies that are already in place, serving the people, or are there things that we need to amend, So also, sorry about the noise, I'm on the road. So like looking into looking into policies that are actually serving the people, and how, and speaking about policies, are we including the young people in formulating these policies and in decision-making tables? Because for me, it's very important, because these policies, these laws, all these things, they're going to affect young people. So when are we going to start bringing young people to the table for decision-making? And from the decision-making and from the formulation stage all the way through, because we have not seen this happening a lot, but recently we are happy to see some changes. But can we look into not using young people, or just like we want to write reports that we had representation of the youth, but there's no meaningful youth engagement? There's a difference. Using youth as subjects rather than their meaningful participation. So are we listening to ideas that are coming from the young people? And as I began, I said that young people are very innovative. So are we listening to all the ideas that are coming up, like what Brian is doing, the intersection between art and mental health? That is something that I honestly feel like we need to bring more evidence-based approach behind that, and see how this is gonna serve not only the young people, but also the larger population, So I think for me, that's what I would add. And I just like to echo on what David said about looking into the social factors or the social determinants of mental health, such as, financial issues, food insecurity, stigma, and discrimination. Are we looking from it from the grassroots level, and how are we coming up with, projects or programs that with our own organizations, or even with the government, who are the duty bearers? How are they coming up with programs to directly solve these issues? Because these are some of the issues that are really leading to a large number of suicide cases.
Thank you, Maureen, for sharing your insights. Brian, do you have anything to add?
The problem of speaking after two intelligent humans speaking is you lack points. So I think one thing that probably David and Maureen might not have really captured well, and just adding to what already is, I think we need to work with and not for young people, because for us to know where the problem is, there's a need to have a needs assessment, before initiating programs and bringing up programs that we feel will work for the young people. There's need to know what exactly is, what do we have, what has been done, and where is the gap? And that means you have to work with the young people. And that calls for us to now look at, do we have existing data? Do we have existing numbers in terms of at what point, or what are we looking at to come up with these responses? What is our reference point? And that means that there's a need to have a community-led response mechanism, which means the community is the community is responsible for the design, the implementation, and even finding the data, and even responsible for the data collection. in that the community for us in this point is the young people, yeah? So the young people are at the forefront of understanding what are some of the issues that you're facing, how can we address these issues, and if you want this data, where do we get data, how can we collect that data? Like, being engaged does not really mean that now we're only being told that this is the design, and then when it comes to the implementation of there. When it comes to community-led response, young people are at the forefront of doing most of the things, and those who are capable of doing the analysis are also being engaged. So I think for us, it's how to address this. We need a starting for a reference point, which is need for data. I'm just from a session where the ministry was hosting Dr. Zaguga and Dr. Naomi. And one of the things that was coming out was, how are we documenting issues of suicide? Who is talking about this, and where is this data? And it's clear that we have that data out there, but apparently as young people, we don't know. Apparently, from that session, I just learned that 10% of suicide-related cases are not related to mental health, not even close related to mental health. And this is something that all of us always think that for you to try or attempt suicide, you must be experiencing or having or like a comorbidity of having a mental health condition. No, sometimes it's either an ailment or a chronic disease, which accounts to the 10%. But how do we address issues like not every young person has a mental health issue? How do we address other issues that are not mental health related? So it needs a very comprehensive and engaging discussion before even coming to now looking at programs that are going to address. We need discussions and conversations and dialogue just to understand what are these issues. And it starts with starting with the person next to you. Like, who is that person? Like, just ask them, by the way, do you think probably for someone to attempt or try to end their life by suicide is very normal? The kind of response they give you will really tell you whether there's need for us to have further conversation, or now we have to go further to now start designing implementation or responses. So I think for me, it's where the starting point is and what we get from it, and work with what we get for us now to move forward in terms of coming up with possible intervention areas. Over to you,
I think, thank you, Brian. I like your point about engaging youth, particularly in project design, implementation, and even after that, the monitoring and evaluation of the project. Have the recommendations been implemented? Have they been placed into policy? Because we are not only talking about evidence-based policies if we are not engaging them from the grassroots level. And also particularly on your point of scarcity of data, because we understand that issues of suicide, particularly among the youth, are not well mainstreamed in the media. And for this reason now, we lack a database that could help us in suicide risk surveillance systems. In order to pinpoint the cases, just like you mentioned, not all cases are due to mental health disorders. Could be probably because of drug or alcohol abuse and such like things. So how do we come up with a database whereby we can assess the risks and pinpoint the cases of these suicide rates and their causes? And now that we've now talked about policies, so what do you think are the current challenges or drawbacks within our national health policies in addressing mental health, and also particularly now with regards with our conversation, suicide prevention? So like you've mentioned, I think one of them would be now the scarcity of data. So what are the other major challenges that we are facing in our national health policies to address suicide prevention? Dr. Odhiambo.
Thank you, Marion. Actually, based on the conversation that we've had, when you ask me what are the gaps we have in terms of our policies, I'm going to reflect on this from a book that I recently finished, The Future of Capitalism, Facing New Anxieties. It's a book by Paul Collier. Everybody would tell you that capitalism has failed, we have a terrible world, injustices are everywhere and they're increasing, yes. It's a fact we have injustices that are increasing, but what are we comparing it to? And that is where our problem starts. Because in all the challenges that we're seeing, for us to have a working society, some of the propositions that Paul Collier outlines are, one, we need to have a shared identity. We are part of the common community, and the problems that we're dealing with are our common problems. The solution that we are hoping for are our common solutions. So we have a shared identity. We own up our challenges. We own up the commitment and the responsibility of finding solutions to them. Do we have a shared identity? And that actually translates even to the policy level. When we have policies, are these policies owned by the people, or are they policies developed by policy experts and consultants who are out of touch with the actual common society? The common man at the local village where they are, do they have representation at the policy level? Do they have their needs reflected and actually documented in the policy instrument that are going to guide government and stakeholder investments in health? When you talk about it from a healthcare perspective, definitely or maybe not to a greater extent. That is one key thing that we need to ask ourselves. Then with that common shared identity, he argues for two other key aspects. When we have a shared identity, when I see somebody we have a commonality with, I'd want to help them when they're stuck. Acts of rescue. How often are we willing to walk out of our own journey to reach out and support another? The other bit is a reciprocal obligation. I know that when I do the right thing, Brian will be out there to support me in case I'm actually also having a challenge. So those are the kind of aspects that we need to ask ourselves. So from a shared identity perspectives, our policies, when they're being formulated, are we owning them? Are we part of the process? And it's interesting that in the discussion, as we've been going through it, we're talking about engaging young people, working with young people, using them and working with the solution with them. We are young people in this forum. Because within the panelists that we are here, and Marion as well, I believe none of us is past even 35 years that is considered the age cap for that up to under 35 of being older people. So we are all young people. The question that we need to ask ourselves, are we playing our part where we need to play that part? Because policies should be evidence informed. What is David doing where he's working to ensure that these policies and these contributions that he's making are documented and captured at the ultimate level where policy decisions are being made? Because if we talk about engaging young people and we detach ourselves from it, then we don't ask ourselves, what role can I play to ensure the policies are informed? Currently, we have policies, we have actually a divide in the sense that the policymakers and the government technocrats and bureaucrats will be working on the documentation. They have very good policies because that is what they envision should happen. But then the common mwananchi, the common young person who needs the help, who needs the services, is in a village somewhere, doesn't even know the policy exists. We have a suicide prevention policy or act by the government that was recently launched. How many of us in this particular forum, the 25 participants that we have, know about its existence? And if we know about its existence, what are the provisions in that particular document? Do we? Most likely not. So we need to understand that these documents are being developed and none of us are getting involved. So that is the starting point. In getting the data, we need to get the information and inform them where they're being developed, which means we have to do our work and document whatever it is that we are doing. Then the next phase is having these kind of conversations. If we're not having these conversations, we are missing out the point because we are not able to cross-share the information and actually cross-pollination in terms of one idea being shared at one point, another being discussed at another point, which is not happening. So we have policies that are formulated, they exist, the financing is following those policies. On our end, we are staying detached from what's happening, we don't even know. And when we know, we have also this kind of predatory approach to policy making. We make a policy because there's growing interest and financing for it. I remember when I started the work on mental health 2017 all along to this date, we've had conversations a couple of times with Maureen, Brian, in the different forums that we engage in, and with some other colleagues as well. And one of the key things that we're talking about is over COVID period, every young person has come into the discussion on mental health because there is international funding that's coming into the space and people feel like we need to get a share of that money. We need to find a way to make use of that money. Yes, it's good if you can make the money, but the question is that the motivation? And that is where the first analogy that I was looking at reflecting from the other book, the book, The Future of Capitalism, do we have a shared identity that we want to solve our problems, or are we using the problem as actually as a trap to get the benefit that we hope for? Because if we do that, we are missing. And that is one thing that we need to look at from our policy imperatives. And the other thing, our policies are kind of, actually, they're not connected, they're segregated. In the sense that we exist in communities. David doesn't only go to the hospital to determine whether he's healthy or not. I live in a family, and living in a family, it means I relate with people, I work in an organization with other people, and at the end of the day, I have to travel using the transport system. So is our whole ecosystem having framework that are actually going to promote my well-being? If I know that even the neighborhood where I stay, it's not safe for me, that is already a risk. The distress is already there for me. So are we creating policies that are actually integrated and cross-sectoral in ensuring we have an enabling ecosystem to thrive at it? And I think those are some of the gaps. When we talk about suicide, we talk about mental health and all that, we are talking about them like we are talking about a container somewhere. No, this is a human being with all the different facets of their existence and their being part of that ecosystem. So are we looking into that, or are we looking at them at piecemeal aspects? And I think those are some of the things that we need to look at. And just as a concluding remark is the fact that that is what we are hoping with, for example, what Marion mentioned at the start, the Mental Health Youth Champions Network. The young people are the most affected, yes, but at the same time, as much as we are the most affected, we are the people who can design solutions. We are the people who can overcome the shortfalls and the gaps that we are seeing. How do we do it? By doing what we need to do where we need to do it, by documenting what we are doing, and actually consolidating these to inform policies by engaging in the different forums where this feedback is being collected. If that happens, we are going to be able to achieve the success that we are hoping for. And that is why we are looking at how do we bring these voices together? How do we consolidate our input to get the data and get the imperative on what needs to be done? Then how do we merge our voices to amplify that and ensure the policy instruments are informed by our own lived experiences, are informed by our observations, and are informed our aspirations, our hopes, and our beliefs in what is possible in terms of overcoming these hurdles. And if that happens, then we'll be in a better society. Back to you, Marion.
Yeah, thank you for that. I believe that's a challenge for us to come up with home-bred solutions and also to address challenges that we face, and also find forums that we can address these challenges. And I'd like to also take a question from one of our participants that is related to the question that I just asked. He says majority of young people do not know where to seek help. So how can we integrate mental health into existing health systems? We were just talking about, we had a previous webinar where we were just talking about universal health coverage. So we see also as another challenge that we are facing is access to mental health care, particularly with regards to affordability. So where and how can young people seek help, and how can we integrate mental health into existing health systems? Brian, if you could take this.
Sorry, Marion. Would you mind repeating the question? Sorry.
Oh, okay. The thing was, I wanted to take a question from one of our participants. His question is, majority of young people do not know where to seek help. How can we integrate health into existing health systems? And I just mentioned that the major challenge that young people are facing with regards to accessing mental health is affordability, where and how to get this help. So how can we integrate mental health into existing health systems?
Well, hey, that has been our biggest challenge so far, because the issue of cost and accessibility has always been and still is a challenge, especially among not just young people, but generally. However, the simplest and the most easiest way is us working with the closest unit of the society, of the community, which is the people around us, and that is working with the youth-led organizations, and even trying to identify who within the organizations that are directly linked to the community are able to offer these services. So it starts with capacity building, and I'm glad that one of our community champions or community-led champion organizations here, like there's Nzumari, that they've done a very good job in making sure that they are provided very quality affordable services for the young people in the community. And that approach has seen or shown how just working with a small system of the community can bring out a bigger impact in terms of reaching a larger group of young people with services. So it doesn't need to have only professionals. It just needs capacity building and having the right information and having the right people trained and capacity build on how to approach mental health issues, like the psychological first aid training. It's one of the essential first approach to mental health in the communities and in society. And the other thing is social media is its way, it's our medicine, it's our poison at the same time. However, we can always share referral or links to friends or people around us through social media, yeah? And that starts with just having very simple, like the WhatsApp spaces, WhatsApp status, yeah? And our Twitter spaces. Like we have free and affordable services within Nairobi. And I know after this session, we're going to share that. I know David already has that. So if you need that, I know Right Culture is going to provide. So we have services within Nairobi that can provide free services. And the other discussion, the third thing is that the Ministry of Health is currently working to ensure that NHIF covers mental health services. So if you have NHIF and you need services, I think Mathare is currently doing that. That's one of the discussions that we're having from the previous meeting, that Mathare is already trying to integrate NHIF within their services and just seeing how that can cover the medical and psychosocial services of persons living with psychological, cognitive, or intellectual disability. So I think those are the three main ways I know that can work or are currently being used around us to ensure that young people access quality services and quality and affordable services of mental health. Maybe Maureen or David have something to add on that.
Yeah, I think when it comes to conversations on, integration of mental health into existing health system is quite a conversation, I would say. And for me, I think Brian has really captured it well about how, CSOs and how also we can try and how the government is also working to integrate this into NHIF. But there's something that I will always say, that there are things that the government is the primary duty bearer. I mean, as CSOs, as DPOs, as NGOs, we can do the most, but there are certain aspects of where the government should do. Because the government remember, they have three duties. They have the duty to protect, they have the duty to respect people's rights, and they have the duty to fulfill all these rights. And the first thing is that health is already a human right. And everybody, everyone who is born today, tomorrow, wherever, they have a right to health. So for me, it's how are we as NGOs, how are we as mental health advocates, how are we as CSOs holding the government into account so that we ensure that this integration is taking place, because they are the primary duty bearers. We can only do the most, but the government is the primary duty bearer. Oh, sorry. Is it me? Can you hear me?
Yes, we can.
Okay.
Yeah, so well said, Maureen. I've actually attached the suicide prevention strategy by Ministry of Health for your reference. You can see the strategies that have been put in place by the government at national and county level to be able to mitigate suicide cases. And also, finally, the last thing I'd like us to talk about would be, are there any best practices in your line of work or through your experiences that are viable in tackling suicide cases or reducing suicide mortality? Could be in your areas of work. Are there any policies that have been implemented that proved helpful in terms of mental health? So over to you, Dr. Demborkin.
Okay, before I get to the best practices, I just want to look into the rest of the question that Brian and Maureen had responded to. And I think in terms of integration as it is, their contributions are amazing. And those are the key things that we're looking at when we look at it from a focus on mental health and integration of mental health services where it needs to be given. But one of the key things that we also need to ask ourselves, what is the definition of mental health as a starting point? State of well-being, where you are able to function optimally, contribute to your society, cope with normal stresses of life, and therefore that means you are at your optimal level. And if that is going to be the case, then we need to ask ourselves, what are the drivers to all these in our ecosystem? You in your family level, beyond family, in every child has to go to school, therefore the schooling system has a role to play. So do we have these services being integrated? I remember when I was a small kid in the village, we had these clubs where we had, let's say, the peer counselors and the trainings that were taking place. It's been a long time, I've not heard of them anymore. Actually, I have a niece that I engaged with a couple of times, and I've never had her talk about peer counselors groups and all that. So the question is, are we giving young people the key social skills that they need to cope with stresses in life? Are we making them be solution providers to their peers in their networks? Because probably you might not be able to get to the hospital when you need the help. Are we in the society able to offer the services? That would be actually my greatest request to every policymaker and even the government in whichever space they are. If we can ensure that everybody going through school from class 1 to Form 4 and even into university or tertiary college, whichever way you're going to, you have the basic psychosocial counseling skills. You can serve as a peer counselor. It means, one, you're able to actually identify in case you're having a challenge at a personal level. And therefore, you are able to know, where am I going to seek that help? Because oftentimes, in terms of the mental health space, we know people have problems they're dealing with, but they don't consider them a mental health issue, a mental health challenge, and therefore, they don't go for the help they need. Or they go for that help in the wrong spaces. Therefore, they don't get the solution they hope for. So can we integrate mental health services in our own ecosystem, in our own livelihood to ensure it's meeting what we need to get? That would be key for me. And that is one thing that I feel could be advocated for and could be championed for and need to be championed for in whichever space that we are operating in to make it be adopted. So some of the best practices that I know is in the spaces that we've engaging with and all, there's a program that I engage with, that is the Basic Needs, Basic Right program. And there is the buddy system. Under the group, we have social champions. These are people with lived experience. And within the network, what has happened is we have buddy groups where after every week, you'll find you'll check in with your buddy in the network. And that buddy will be able to share with you, and people who have common, we have a shared identity in the sense that we are all people who have gone through rough patches in our lives, and we support one another to maneuver and actually find solutions to our challenges. And therefore, it serves as a social support network, which is a good practice. Do we have our buddy networks? And it doesn't have to be in a formal framework like the one that we have under the Basic Needs Basic Right. It can be even in our own friendships. Do I have friends that I can talk to and engage with in looking at how do we find solutions to our problems? I have a friend. Do I normally check in with them? Do I check in with them beyond just calling them out to hang out, or do I check in with them just when we have to hang out with them? Those are key things that you need to look at. From the aspect of corporate work, we have our own, within the company that I work for, that Novartis, one of the key best practices that I've adopted is the employee well-being program. That is work-life balance, work-life integration programs and activities where on a monthly basis, we have a day that we just, the whole afternoon, Friday afternoon, we go have physical activities and engage and have fun with each other. But at the same time, we have conversations within the team on how can we work better? How can we overcome the pressures of life? Because even when you talk about suicide, we understand that some of the drivers have always been a workplace pressures and demands on you as an individual. So how can we overcome such pressures? And if we create an enabling ecosystem where you know that your employer cares about you being at your best optimal performance, and then you have these opportunities, avenues where you can decompress and just feel free to engage with your peers and also relate. Because one of the things that, especially during COVID-19 and the breaks that people are working from home, remote working and all, when you used to go to the office with people, you feel like, well, when there's pressure, you can also share and as everybody sees it. Now you're working from home, you might be working 14 hours in a day, but you still feel like you're doing less than what you need to do. Therefore, the pressure is too much on you. But if you have such kind of opportunities where you get to interact with your colleagues and actually share some experiences on what you're dealing with, how you're going about it, and you realize, oh, even these other guys are dealing with the same. So it means it's not an isolated case. It's not about underperformance or incapacity in myself. Then it gives you the relief and ability to cope and do better. And those are some of the experiences that I could just share this particular moment as things we need to adopt and we need to encourage in our own ecosystems and our own environment where we operate and work. Back to you, Marion. And I've noticed there's somebody who has been raising their hand. I think it's Francis, if I'm not mistaken.
Yes.
Back to you, Marion.
Okay, thank you. I'll be giving Francis Wairimu a chance. And that just reminded me on the previous conversation that we were having about strategies that can be put into place. And you've talked about community, because we know that we exist in a community. We do not exist, in a vacuum. We exist within a community. So I think one of the best practices also would be to train community health workers such that we empower them with information and knowledge that they can be able to disseminate to the people within their community. Far from that, we also have religious leaders. We have people who really trust religious leaders, and I believe it is paramount that we should be able to engage everyone, key people within the community, in order to disseminate this information. Before I move to Maureen and Brian, I'd like us to hear from Francis Wairimu. Go ahead, Francis.
Hi, everybody. Can you hear me?
Yes.
So my name is Francis Wairimu. I also run a foundation called the Alpha Nuggets, and Alpha Nugget takes care of young boys and men, also trying to look after their mental health. And this is simply by the saying of Mti Mkunje Ngali Mchanga. Hopefully everyone understands that in this platform. So first and foremost, in the years that we have had this mental health situation, because during COVID is when it went off the roof, and we understood and we started pushing for this campaign and also did the first mental health walk in correspondence with Cities Rise, Akina Maureen, etc. But now we have to come back and ask ourselves, did the strategies we put in place, did they work? And if they worked, to what percentage did it work? I have had a situation where I've had someone raising the question about the government can only do certain things, but how do you push a government? How do you push for legislation to be stipulated? By being involved. How do you get involved? We cannot continue being in the boardroom, because right now what we are doing is like we're in a boardroom. We are not out there. Because for the longest time, we've continued holding these online meetings, but have we given the person in Laikipia, in the interiors, an opportunity to connect? We haven't, but yet we are still speaking about mental health. So what is the long-term? The long-term view is to bring down the numbers. But how do we bring down the numbers as we get there? We get involved, just as the government has devolved health. We have to devolve the situation as NGOs. And I'm doing this as a call out to the NGOs. We cannot keep on saying, oh, we have measures, we have things stipulated, we have things that are supposed to be happening in this way. We cannot continue speaking that same language because it has proven it is not working to its full potential. A key example would be the elections. Why did the youth not turn up? Because the youth of this generation does not believe in doing things manually. They prefer doing things online. They would rather have an app or something. So how about the NGOs coming together with developers and producing something that a child from grade 1, 2, or 3, a game that will increase awareness of who they are. They start understanding that when I wake up and I don't feel like speaking, I don't feel like doing A, B, C, D, this is the problem. When this kid starts to understand that this is the problem, they're able now to come out and ask for help. In other sense, even the young people out there, what do? The NGOs pick up the counties, all of them, figure out key people who can communicate to these county officials that this is what is happening. Mental health is a crisis. Let the people who are representing us as the NGOs be the people on ground, people who have gone through the situation, people who are willing to understand, and people who are willing to give back to the society, take care of their needs, probably give them an allowance that will cater for the rent, cater for their basic needs so that they are able to give their all to represent the organization. Because for the longest time, like right now, even when we call out for a meeting, let's say like right now I call out for a meeting that we should meet for mental health and all that, it will be strictly in Nairobi, obviously. Number 2, we will have the like-minded, the same people I've been seeing all through the years without an addition. That means we are not bringing change. And then accountability. We are not being accountable. We are saying that we are mental health practitioners, we are mental health advocates, but yes, you're an advocate. Do you have facts and figures on the ground that last year when I was starting, I was dealing with this amount of people? This far, I have been able to acquire this amount of people, and I'm running out of resources, and I need help here and here and here. Then the government will see a need. But if we continue having these conversations and inviting people who, unfortunately, I'm going to use this word, are irrelevant. You can't speak about men and not have men in the room. You cannot speak about women and not have women in the room. You cannot speak about mental health and not have people who have struggled and understood and gone through the process of mental health. Same way, we want to involve the government. How do we do this? Go to their offices for those meetings. Instead of meeting in our different places, go to those offices, hold the meetings there, show them facts and figures. That way they are able to adapt to a system. Because unfortunately, if we continue doing this cycle of saying, oh, we have put measures in place. Yes, you have put measures in place, but if I go to your wall, is it the first thing I will see? Is it the first pinned tweet I will see? We need to share so that, because at the end of the day, knowledge is power. People perish because they do not have the knowledge. So can we create the knowledge on the ground? Imagine it only takes one matchstick to light a whole forest. So when you go to that ground and you light that match, it will affect 10 different individuals. These 10 individuals, if the NGO is focused on dealing with the people on the ground, these 10 individuals will give us another 10. There'll be 20. By the time you realize, within an year or 6 months, we have like 50 representatives who, one of them we are taking care of personally, the others have seen the need and they now have ignited this fire that they want to be involved in. So we need to show these young people that we want you to get involved. Provide ways for them to be involved. And when you do that, when even you yourself, right now, if you're put in an office and given a project, and then there's a team that is welcoming to that project will be successful because you're a team of like-minded people who have the same goal, or the same goal but with different tactics. It is time for us as NGOs, as representative, to go back to the drawing board and understand and realize that we did put measures in place in 2019. It is 2022. What is happening? Why aren't we growing? Why isn't still someone in Mathare, someone somewhere in Wajir, someone in Laikip, every single point of the country, why does this person do not know anything about mental health? Then you go back to that drawing board and start sketching towards that. Because yes, we can involve the government. Yes, we can speak to the government, but the government, since it's ruling people who do not know anything about mental health, it will be easy to push and brush off that situation. Thank you so much. And yeah, for the platform and me.
Thank you so much, Francis. I believe that is a very perfect and succinct call to action. Accountability, devolving these conversations to people who are otherwise not able to reach out, and also involve people and involve the government. Thank you so much for your insights, Francis. We appreciate it. We shall capture that and put them to action. Maureen, one of our panelists, had to leave. She sent her apologies, but I believe you have gained a lot from the insights she has shared. Back to the question that I had asked earlier about best practices in your line of work that have proved viable to be able to tackle suicide cases. Brian Ochen, I'd like to give you a chance to answer this before we go on and also tackle some of the questions that have been posed by the participants. Brian, over to you.
Sorry, I'm on and off. Just again, kindly.
It's okay. I wanted you to tackle the previous question that I had asked about best practices in your experience, be it in your line of work, that have proved viable to tackle suicide cases and reduce suicide mortality. Thank you.
Well, I can never say there's always one way of doing something. However, when it comes to mental health, generally it starts with understanding or knowing the triggers and the onset of what leads to you having that episode. And for suicide, I think for me, the biggest and the most important thing as Brian has been information, yeah? And creating an enabling environment. So let me start with information. Information in that people know that there are other people who are undergoing the same thing. Me not feeling alone, yeah? Me not knowing that, me not like having a certain condition, like being in a state of depression, does not make me less of a human, and appreciating that, yes, there are days that are going to be good and bad. And suicide in most cases, we term it as a mood disorder because it's because of the mood that we tend to feel less of ourselves, or sometimes look at life as meaningless, or have those tendencies of wanting to end everything because there's no hope. Yeah, in most cases it's mostly about hope. So how do we provide that information in that, yes, you can get help from this place, yes, you're worthy of being alive, or you've earned that life and you're meant to have it, you're meant to preserve it and continue living. And however you feel, it's okay. If you feel like today I'm feeling crappy and I just don't feel like being, it's okay. You should not be victimized for feeling that way. Yeah. So that information. And then once we have the information, are we able to provide safe spaces, like an environment, an enabling environment where someone is able to experience or feel how they want to feel, or how they're feeling, without being victimized, judged, or made feel less of a human being because of how they're feeling, or the conditions they're going through. So for me, for the longest time, is we might have biomedical approaches, we might have counseling, but if these enabling environments are not right, then there's a number, like we face relapse most of the time. And that's why in most cases we have therapy not just looking at the individual, but also looking at the society and the family and the surrounding, the social life of that person. So if there's any trigger or a stimuli or a trigger that might lead this person to like going back to where they were or not really progressing very well, then these are some of the things that we face. So that is not just an individual approach, but a multifaceted approach towards addressing mental health. So I think for me, those are the two key things I would look at in addressing suicide prevention. And again, let's keep on sharing, just being very kind. Kindness is free, and it's one thing that makes the world go round. So just be kind and be very sensible on just how you reach out to people and how you are around people, because you never know what someone is going through. Yeah, it just takes one kind word for someone to appreciate themselves and be like, I think I can manage an extra day. Yeah. Over to you, Marian.
Thank you, Brian. I'd like Dr. Odhiambo to tackle one of the questions from the participants. From Lucy Mukavi, she says the COVID-19 pandemic affected many people's mental health. Families were broken, people lost jobs. So a lot happened and people are still yet to come to terms. What strategies are in place for these people? What future plans are there to curb the aftermath of such? So are there any learnings that we got from the COVID-19 pandemic? What can we do better? Dr. Odhiambo?
Thank you, Marian. And when I look at these, I totally acknowledge your concerns, Lucy. And these are realities that we're facing as a society. As we look at it, yes, during the government interventions and all that, whatever happened, there were these kind of funds transfer programs and all that. I'm not so sure of how the progress has been in terms of cushioning the vulnerable and those most affected, but those are some of the interventions that came into place. And as we are moving forward now with the new government as it is, and the dynamics of how the world is, I'm not so sure whether these will be sustained or not. But this brings me just to the specifics on what we need to do ourselves. How do we create enabling ecosystems where we can support one another and see how to overcome these challenges? And that is where we need to look at it from a resilience perspective, a skills capability building at individual level to be able to cope with such challenges. And the future plans would be, for me as a society, I think we've failed. And this is a fact, even from whatever Francis was saying, both from a government, a CSO perspective, an individual initiative that you're running as yourself, or even as an individual in the society. We have failed. We have failed because, one, we don't know what challenges are there, and where we know, we look at them from a point of what do I need to do for David, not what do I need to do which is right for myself and for the society that I'm working in. And that is a loss that we all have to contend with every single day. You see that there's a problem somewhere, this is our problem, and that needs to be looked into. So for me, the most critical plan would be for us to take responsibility and ask ourselves how we are going to work to overcome our hurdles, how we are going to work to ensure there's a safety net for those who really need it. And beyond a safety net, which would kind of be a gifting framework, we don't need gifts. We don't need handouts. We need a society and a system that works, that will ensure that even with such kind of devastation that we went through, I would still as an individual be able to have a safety net in terms of a revenue stream that keeps me moving beyond where I am. And that would be in terms of even when you talk about the salary level that people are being paid. What is the minimum wage? What is the productivity level? And is this productivity comparable to whatever this person is making at the end of the day? Because if somebody lost a job and this individual cannot even sustain another month's living without getting another job, that is already stressful. And even however much we could try to talk about COVID and all that, COVID is not the only thing. What if this person actually just had another mishap that made them lose their job or actually made them stay out of work? What would have been the dynamics even without COVID? So we need to argue and actually champion for such kind of reforms that will ensure we are able to overcome most of these struggles as they are. And the plans would be for me and you to commit. And me and you to commit to do what needs to be done, to hold people accountable where we need to hold them accountable. And beyond holding them accountable, then ask ourselves, how do we ensure we have a system that delivers? Because if I hold myself accountable today and do what I need to do today, but don't fail to put in the structures to ensure whatever I'm doing will be incentivized among my siblings to continue doing the same, will be incentivized among my peers to continue doing the same, and my next generation, my children, in case I have children, and how does that continuity come into place? If we don't do that, then it will be a solution for this point in time, but after that, it will be done. And that will be the society that we are living in. So how do we ensure that such kind of challenges are overcome? It is by us committing and doing what we need to do. And most importantly, even looking at our governments and asking them whether the solution they're presenting are sustainable or they're just solutions it's kind of PR and they're superficial in some way. Because if somebody gives you food today and tomorrow they won't be able to sustain it, then that would be a problem altogether for all of us. So we need to look at such. And that is all I would say for now. Back to you, Marion.
Thank you, David. The final question we have here is from Bernard Murage. He says, we have the suicide prevention strategy in place that touches on most of the points we are getting from this conversation. So the challenge comes with the implementation strategies and management. So his question is, out of the policies and the conversations that we've had, how do we make it possible for youth or the most at risk to access a healthy lifestyle? How do we make it possible for youth or the most people at risk to access a healthy lifestyle? So Dr. Odhiambo, David, you could take this, and also Brian, you could weigh in on this question if you have any insights to share.
Okay, thank you. And thank you for your contribution, Bernard. It's commendable that you've acknowledged actually the problem that we're having is we have strategies, we have frameworks in place, but when it gets to implementation, that is where actually, I think it's kind of we get waylaid or we just fail to do it. And I would say one thing that we have to acknowledge around all the policies and strategies is we develop them, yes, but we develop them because there's a resource pool that has been made available for people to work on that strategy. It's either there's a development partner funding it or a government has an interest in it. Let's say, for example, the mental health task force that was constituted by the president, the budget line was there for it. At the implementation, probably the partner that helped in the development of strategy hoped the government would take responsibility, but the government of the day doesn't want to, or actually doesn't see the need to. So that becomes a lapse for us. And that is where our implementation challenges start stemming in, because the person who developed the strategy was doing it as a job, not as a vocation in terms of making a difference and contributing impactfully. So that becomes a problem for all of us. So that is one of the things that we need to look at. Then beyond that aspect of it, in terms of failing to implement, now we get to what you're asking ourselves: how do we make it possible for the youth and most at-risk individuals to access healthy lifestyles? We need to start by incentivizing healthy living. We need to incentivize healthy means of existence and actually the most sustainable ways of existing and living. Currently, among the youth generally, the best experience in life is to be drinking alcohol, to be using drugs. Go to Twitter even now. That is the lifestyle that we are hailing. That is the lifestyle that we are celebrating. I'm not against alcohol consumption, but responsible consumption of alcohol is what we need to look at. And even the drugs, some of them are not recommended. I'd discourage everybody from using the drugs. But how many of us are actually celebrating it? And if we do celebrate them and it becomes the best way of having fun, then almost everybody will want to have fun, right? Because I don't think there's anybody who wants to live a boring life. Personally, I don't. But if having fun is associated with consuming drugs and doing certain things that might not be as healthy, then it means we're incentivizing unhealthy living. The alternative would be for us to incentivize healthy living to the extent that people who are engaging in healthy living activities, healthy programs and all that are encouraged and given a platform to actually talk more about what they're doing. And that is what can help us overcome some of the challenges that we're having as a society, because we get the motivation and get the inspiration of doing what's right, because it is working for some people and it's working for people that we look up to. When you go to, let's say, for example, with the digital advent and every advancement that we had, I'm actually avid graduate of YouTube University. And I would consider myself probably a professor of YouTube University, because I look at content that I feel are enabling for me. And one example that I would just share with you is there's this guy by the name David Rubenstein. He has the David Rubenstein show on Bloomberg TV. This guy is a renowned private equity investor who has worked for the longest time possible, one of the richest people in the US as well. But beyond just existing and going through his life and making the money, he's converted his access to highly influential people and very powerful people to share insights on their life journeys. And these are people who are doing amazing work. And by sharing their stories, they're sharing a story that uplifts, that inspires, and creates a blueprint for others to follow on. Those are talks on leadership, peer-to-peer conversations. How many of us actually know the healthy lifestyle that we would want to embrace and are not doing it? And how many of us know about them, are doing it, and not sharing with others? So unless we market it the way marketing of the unhealthy aspects are taking place, people will not adopt them. And when people don't adopt them, every single year, every single week, every single day, we will be talking about the challenges, we'll be talking about the shortfall that we have, but not making any step towards solving these problems as we wish we would. And that would be our own main undoing. So my encouragement would be, let's incentivize and let's continue moving that journey. Back to you, Marian.
Thank you, David, for that. The other question is to Brian. Mary Nyagol says, to your survey, what percentage can you say know how to identify someone who is going through a mental health issue or disorder? And what percentage know how to deal with it and handle someone who is going through mental health services? And are there any key training structures that have been put up for caregivers, guardians, and education institutes? Brian, over to you.
Well, I don't think I'm in a position to give exact percentages of who's been trained and who's been not really trained. The question was, are there percentages who know to deal with it and handle someone who's going through mental issues? I don't think we really have that hands-on in terms of percentages, because as I mentioned earlier, the challenge you're having is we lack data. And just to reiterate what David had mentioned earlier, that we have very good policies, we have very good guidelines and structure and like very nice documents that guide on how to implement mental health, but the structures in place to now implement is where we go wrong, and it's what we are lacking as a country. The same thing goes for data. I would be lying telling you that this percentage or this number of people are well equipped to identify mental health conditions or even address and refer persons with mental health conditions in the community or nationally or globally. Yeah. And the other thing is, you asked, you say you know how to identify someone who's going through a mental health issue or disorder. To your survey, what percentage? Again, we don't have that percentage. Like I personally don't have that percentage. It might be out there, however, we don't have a consolidated or a uniform center point for information where I can tell this is where you can find 100% information. And even for the MOH, they're already trying to have that figured out. Yeah. However, what I know is we have resources. That's one thing I'm sure of. We have resources for counselors, especially during COVID, the number of resources that were done for counselors to provide counseling, pre and post counseling for persons who are undergoing COVID or victims or survivors of COVID. I don't even call them victims, survivors of COVID. sorry for using the word victim. And there's also psychosocial first aid, which is a tool that's used to train community healthcare workers, and we even have clinicians being trained, nurses being trained, health record persons being trained, health record officers rather being trained, and even the community. And I know a number of young people here have been trained, and David is among them. I don't know whether Frank ametrainiwa, but a number of young people who I know who've joined this call probably have been trained on the psychosocial first aid. And that's a first step to just identifying and referring. So for first aid, we have the look, you look, prepare, look, listen, then refer, yeah. So with or link, which is L, the 3 L's. So you prepare, you look, listen, then link. So basically, it's just a way of knowing this person is undergoing through an issue, and I'm able to listen to them. I'm able to link them to a service, and I'm also able to follow up, because one of the things that we do is after linking someone, we don't follow up. So with psychosocial first aid training, we provide that platform and that training where you're able to be given skills or provided with skills to provide a hands-on, like first immediate point of care for someone who is facing mental health issues. And then we have a training for care workers, yeah? And the first aid training can also be used by caregivers. And I know there's something that's being done to also involve caregivers of persons living in psychosocial, cognitive, and intellectual disability, just to see how best they provide that service. Again, just going back to what my previous speakers have mentioned, that is Francis, Maureen, and David, we are failing at some point, because as much as we have all these resources, as much as we have the skills and capacity, as Brian, I can only reach a few people, and that's why probably I'm here to provide that information. I can't reach a wide number of people, and me getting to reach that number of people needs resources. We might have resources out there, but the people who are getting these resources are not really utilizing them to provide the right services to the people. Like what Francis said, someone in Laikipia, someone in Lokitokyo who mwenye hajui hata what mental health is, they still think mental health is witchcraft. I can't go to them with psychosocial first aid and start training them without even them understanding where exactly what am I being trained on. So the strategy on how we reach out to people, again, really matters. Not just imposing programs to them, but also understanding from what point do they need this program, yeah? So these are some of the things that we also need to address. And that's why currently, I'm sorry, but I can't give numbers specifically to say that this number of people have this capability or capacity or the skills to identify persons who are going through mental health issues, or the persons who are able to provide services or handle someone who is going through. And trust me, even caregivers, most of them are just trial and error. Like, it's just trial and error. They don't really have that there's a manual, there's nothing for them that has been provided, and for them to go. And if there is, as I said, organization-based and not really streamlined or standardized, that someone else can adapt to, because some organizations come with their own agendas. So you see, these are some of the challenges you're facing, and mostly affecting or impacting young people in the community, because we don't really have streamlined structures on how to work. And again, someone mentioned yesterday, we work in silos. And silos means kila mtu anafanya kazi yake, but we want to come and report back and say, oh, nilifanya, akafanya. But we're not really streamlining our work to focus on the issue that needs to be addressed. So I'm sorry, yet again, but those are some of the things that we have, and very accessible by the ministry. The reason why I keep on referring to the ministry is, as it was mentioned, that is their mandate, to provide guidelines and policies that guide how we operate on the ground. Even the mental health action plan, it is what is guiding us to do implementation of the suicide prevention strategy. It's what's guiding us to do whatever we are doing in the community, because without such guidelines, then we are all going to do everything we feel like. But if you have a central point of reference, then we are all aiming towards one goal. If I take one strategic area, someone else takes a different strategic area, then we are all merging that effort to addressing one issue, which is the suicide, yeah? But if we work in silos without even without referring or using to a specific strategic direction or or a document or a policy, then that's where we've been going wrong. And if we keep doing that, we'll keep having more cases, we'll keep having increase in number of suicide, and even more young people are driving back to issues of substance and alcohol abuse. And we'll keep on having these issues without really having the right way to address them. So that's what I can say for now, but we are headed there. At least what I can say is that if I look at 5 years from where we were before, we've made a number of, we made a stride and progress. So I know we are headed there with time. Let's keep on pushing. Let's keep on making the noise. I know these things are going to change over time. Yeah. Over to you, Maria.
Thank you so much, Brian. Also, we'll be running a Menti poll, so you can take just a few minutes to share. In the interest of time, I'll take one last question from Mohammed.
Good evening. I am Mumtaz Mohammed. Thank you for the wonderful session, David and Brian. I have a question on suicide. Mostly we concentrate on suicide in the age between 17 and above, that is the youth, which are the most affected. But currently, I think we realize that we are having a lot coming up with the young children, age 7, 10, 11, been committing suicide, especially after school before they reach home in time. What do you think of the suicide of such a small age? What are the contributions from parents and school? And how can we sustain? Because everything we're talking about, if we are having an online session, then it's for us who are benefiting from it. These are kids who don't have access to such platforms, but still they need us to have the mental health program roll out in school. You find that the last case, I think, was a week or two ago that happened in Machakos County, and it was devastating because that kid was around 9, 8 years, such as at a small age, but someone living and was saying that they committed suicide at a young age. So what can you say on that?
Thank you,
Mumtaz, I lost you. Oh, sorry, David, because I'm dropping off in a few. Let me just make a few comments. I kind of lost you at some point, Mumtaz, but just a few key terms. You don't commit suicide, you die by suicide, because we're trying to change the stigma around suicide. So that's just something that you also have to learn today. We no longer use the word commit suicide. It's die by suicide or end life by suicide. So end one's life. So you don't commit suicide. Saying committing suicide is so stigmatizing. And just in line with that, I think some of the advocacy areas we need to focus on is the cap 6. Is it cap 69 of the penal code? Yeah, where the penal code cap 63 that criminalizes suicide. So these are some of the things that we also need to look at, and these are policy issues. So we need to start looking at an advocacy area. And if there's someone here who's good with the Constitution, the law, these are some of the things and areas that, because you're a lawyer does not mean that you can't respond. These are some of the things we need in the community for us to keep on going. So that particular section criminalizes suicide, and we need to decriminalize suicide, and also just look at how best to respond. To Mumtaz's point, with suicide, mental health, as long as you have a brain, this is what my lecturer told me, as long as you have a brain, from child to age, you are a candidate of mental health. And all of us are candidates of mental health. And mental health, especially suicide, okay, specifically talking to suicide, in relation to suicide now, even young people as young as 10 years are ending their lives. Yeah, 10 years. So it's not a matter of age, it's not a matter of the issues you're facing. And as I mentioned, sometimes it's not about, they're not related to mental health conditions. 10% of suicide cases that have been reported are not related to mental health conditions. Just retrospecting back, what are some of the causes of this? It was found out that they're not mental health conditions. So there are other things like bullying in school, there are other things like shaming. And there's a case of a girl who ended her life because of being shamed, period shame. You see, something like that girl probably was just performing well in school, but because the teacher body shamed her or period shamed her, she ended up ending her life just because of being told she's dirty. And if you analyze that, probably that young girl did not have any mental health underlying mental health condition, and this was a 9-year-old. Yeah, so sometimes it's the kind of environment, the kind of situation someone finds themselves in, and it doesn't matter whether you're old or young. Yeah, we are all candidates of mental health, and that means just providing an enabling environment that all of us are able to thrive. And as David said, how do we create that resilience? Like, how do we make sure that in whatever we do, we are trying to build and create that resilience over and over? So I don't think there's a specific age to mental health conditions, and that does not exempt suicide as being only affecting people of a certain age. Yes, it's prone among people of certain age, but suicide is, and if you're not careful, continue being a condition. Yeah, and it's a disorder. So I think for me, that's basically it. I can't say much on that because, again, data. So the rest I'll leave to David because he's the data person. For me, it's more about programs. And sorry, I have to drop off, but thank you everyone for your time. And Marion, I don't think there's anything else. We are having a session tomorrow on Suicide Prevention Day at, there's one by NMS and one by AIRA's Youth for Mental Health, which we are part of with David. You're welcome. It starts at 9:30 at AIRA Neuro Cafe in Westlands. So thank you, and I'll need to drop off now.
Thank you so much, Brian, for joining us and for sharing your insights today.
Thank you so much.
We appreciate it.
Thank you, Brian.
Thank you, Mumtaz.
Okay, so I think now I'll invite you, Dr. Odhiambo, to give your closing remarks, even as we look to end the session.
Okay, thank you, Marion. So I'll just share my screen. I'm going to ask of you guys, let's go to menti.com. Then I'm going to share a code that we'll all key in so that at least we get some feedback on the session, how you found it, areas of improvement, and what we need to look at. And there are only actually 2 questions. So from my screen, the code is 7588-1244. So menti.com, then you key the code 75981244. Still have nobody on the Menti page. Just go to your browser, Chrome, Google, Explorer. The code is 75981244. 7598-1244. We have one person who have already shared their feedback with us. 2 people. We are 17 people, so I'm hoping at least we can get 10 at the least. So help us get to the 10. Great, we have 4 people. Mm-hmm. 5. Guys, I'm counting on you. The other 12, 11 people. Great, 6. Fantastic. How was your experience through the session? That is the first question. Those are 7. We need 3 more to get to the 10. Then we move to the second question. Any more? Any more? Okay, seeing somebody else has come in. Great, one more, the last person. Be the tiebreaker, we're waiting on you. Great. So we have the 10th person. I'm going to the next one, the second question. Moving, you can just continue the same code still. What would you expect moving forward from this discussion that we've had? So that is the second question. What would be your expectations? And you could also just share with us some of the areas that you think we need to improve on so that the next session gets better. One of them is time, because we were to end at 4:30, we are at 4:52. Progress, implementation, facts, yes, we need numbers. And I believe that is something that we need to work on. So from an organizational perspective, one of the key things that we're going to commit to is work with different organizations and different community-based programs and young people generally where they are to generate the evidence, to generate the data. Then we use that data to inform our programs, and beyond informing our programs, to actually use in terms of advocacy and streamline them into policies. Engaging survivors, that is a very important bit, because these people with lived experiences are the people who can help us shape the conversation on what help they really needed when they needed it, and whether they got it. If not, then how can we ensure that help that is needed is available to those who need it? That will be a good one. That is 3. We are waiting for 7 more. Thank you so much. Engage survivors, progress, implementation, facts, more experts. We need more experts, and that is on capacity building, which is also a core program that we're focusing on in terms of building capabilities of people who offer services. Because there's no way we'll expect you to serve a community when you don't know what you're doing with them. So have the chat box enabled. Definitely, we will ensure that is done for the next meeting when you have it, so that we're able to have a conversation as a team. Engage survivors, implementation, have the chat box able. We have 5 more to go, guys. Help us close this, yes. Engagement with communities, fantastic. Participants, we need more participants. Help us, actually, that one I'll push the challenge to you as well, to help us get this communication to some of your networks. When you receive our communication, feel free. I know Marion will be doing the job of sharing these with you on your emails. Please engage with your peers and also share it on your networks so that we get more people and make the progress as we want. We need a progress report as well. That would be good. A helpline to share, definitely. And one of the key things from when you go to our website, reculture.org, ryculture.org, we have the Mental Health Youth Champions Network. The next time when we're having an engagement on these, we'll ensure that the different health facilities that are offering mental health services, whether government or private sector, will be enlisted. And also beyond that, we'll ensure we have some key hotline contacts that you can reach out to when you need help, so that we make the resources available to people who need them. So that would be a key bit. Great, thank you so much, everyone. I see we've already gotten to the 10. Really appreciate, and back to you, Marion.
Thank you, David, for that interactive session. And now I'd like to close this particular conversation. Thank you so much for joining in, and let's keep on sharing this information. Let's not keep the discussions that we've had to ourselves. And also, as a follow-up, we'll be sharing the recording and a report on the conversations that we've had. Thank you all so much and have a wonderful evening. Bye-bye.
Thank you, Marion, and feel free to engage with our social media channels, Agriculture, Health, and Social Innovation.
Okay.
Bye.